good evening, student, and welcome to this recall session of dermatology. So, before I begin, please understand the purpose of this discussion today is not to tell you the exact questions, but actually to get the exact questions from you. The questions that I'm discussing, the images that would be there in my PPT may not be the actual questions or actual images that have been asked. And so we'll upload the final questions after the discussion. So today I would need your help in completing my dermatology questions. So please feel free to write in the chat box and tell me if there is any problem with the question, if any question has not been covered, right? So moving on to the first question. So are you able to hear me and can you see me? If there is any issues there, you can put it in the chat box or just give a thumbs up for me to know that I'm live and you're able to hear me. Hi, Dr. Anuj. So moving on, which of the following does not differentiate psoriasis from other arthropathies? And probably these were the options that you received: nail pitting, enthesitis, dactylitis, and diarrhea. Now we know that psoriatic arthropathy is very common with psoriasis, and commonly we need to differentiate that psoriatic arthritis from other arthropathies. So an important finding in psoriatic arthritis is that patient may have nail pitting. Enthesitis and dactylitis are also part of psoriatic arthritis, but diarrhea obviously does not help us to differentiate. So great. Thank you so much for your responses. Now, I would need your inputs on this question. Was this the exact question? Were the options similar? And were you able to answer it if it was this? So I believe if this was the question, these were the options, then the answer should be diarrhea, because diarrhea does not help us in any way. Diarrhea is not a part of psoriasis at all. And yes, rest of the three findings are very commonly seen with psoriatic arthritis. Thank you so much, Dr. Sachit. You tell me that this was the exact question. If this was the exact question and option, so I think it was very, very easy for you, because we know that these three are findings of psoriatic arthropathy. Okay, any confusion with this? You can put it in the chat box while I move on to the next question. Thank you so much, Dr. Anuj, for further confirmation. So the second question that I have is that there is a gardener in Himalayas who came to you with multiple painless ulcerated nodules on upper limb. Axillary lymph node aspiration microscopy is shown in the image below. Identify the organism. So I have a gardener, I have multiple painless ulcerated nodules. This tells me I'm talking about subcutaneous mycosis. And Gardner is someone who can have a subcutaneous mycosis, and subcutaneous mycosis will present with painless ulcerated nodules. And okay, so okay, absolutely. Yes, you're all right. I also think that the answer would be Sporothrix kenkai. What you see in the image here are the hyphae and conidiospores that you see with Sporothrix kenkai. Sporothrix kenkai causes sporotrichosis. It is a subcutaneous mycosis that travels through lymphatic drainage, and you have multiple painless ulcerated nodules, which is present in linear distribution, commonly seen on arms, commonly seen in gardeners. And if you do a microscopy, you see this sporotrichosis, which is a dimorphic fungus. So you see both the yeast form and the hyphae or the mycelial form of this fungus. And it is, if you look it into the microscopy, they appear like this only. And another important thing is on histopathology, you see asteroid bodies. If you do pastane, you say cigar-shaped bodies. So was नहीं बहुत weak था. Okay, thank you so much, Dr. Yogi. अच्छा, so what was it? Farmer था, gardener नहीं था. Okay, you're telling me instead of gardener, you had farmer here. But still, was the image, the microscopy image was this, or was that also confusing? That's okay. We have always studied sporotrichosis can happen in, it is a rose gardener disease, but it's not limited to a gardener. A farmer can also have a thorn prick or any prick, and this infection can go into the subcutaneous tissue. This exact. So if this image was there, I think it's very clear cut. It is porotrichosis kenkai. If the options were also similar, then you know that painless ulcerated nodules is something that you see with this only. So I don't think so there would have been any confusion. So thank you. If the image was this, then I think the question was straightforward. Any confusion? Okay, now Dr. Shravan is telling me it's gardener. Image was the same. So whatever, whether farmer or gardener, my answer would not change. My interpretation of question would not change. So again, a very straightforward question. And this image is showing you these hyphae, mycelium, and they're showing you these spores. Again, a feature of sporothrix. And this is like internet image of sporotrichosis that you would get. Right. No issues, dear. Don't worry. I'm sure it you would have compensated in any other question. So don't, as I always say, please don't take this recall session to mark yourself. You do not know at times what you did in the exam, what was your mental state there. Probably you marked it right, but you think it otherwise, or you compensate in some or the other question. So if one question went wrong, it does not matter. You probably did rest of the questions right. So the next question which I have is, which of the following is an approved topical drug in the management of toenail onicomicosis? Now this is something new that they have given you, and if this was the question, this was the option. So there are two new topical drugs which have been FDA approved for toenail onychomycosis. One is tavabarol and the other is efinaconazole. So even if you look at the options and you are not aware that tavabarol is the new agent, you know griseofulvin is not a topical agent, itraconazole, caspofungin is not used for toenail onychomycosis, and both griseofulvin and itraconazole are oral medicines. So the only option which was available was tavabarol. Don't worry, Dr. Yogi, as I said, don't mark yourself. You've given the exam, just chill now. So, students, was this the same question? The options were similar. Any confusion with this one? So, I'm waiting for your response here. Great. So, Dr. Anuj has confirmed this was the question. So, answer here would be tavabarol. This is a new topical agent which has been FDA approved. It is not yet available in India, but is FDA approved for toenail onychomycosis. Okay, so you were also given probably the clinical features of toenail onychomycosis. So that further helps you. They have written management of toenail onychomycosis. The next question which I have is, which of the following organism is most likely to cause an infection as a result of walking barefoot? Now, if you walk barefoot, I'm first of all confused whether this was the exact question, and if both these questions were there, were the examiners very fond of subcutaneous mycosis somehow? But if this was the question which was given to me, then walking barefoot would lead to a subcutaneous mycosis on foot. And that is very commonly seen with Madurella mycetomatis, which causes Madura foot or mycetoma. Okay? Yes, absolutely right. Porothrix kenkai usually results in lesions on arms. And my Madurella mycetomatis, which causes Madura foot or mycetoma, it happens mainly on foot, happens in individuals who walk barefoot. This fungus gets into your skin, gets into the subcutaneous tissue, leads to tumefaction, sinuses, and grains formation. So, again, any confusion here? Okay, so they had also mentioned that there was an inoculation from soil, which further tells me that they're talking about subcutaneous mycosis. Any other hints, any other thing that was there in this question? So, guys, I think this is what I have. Now, I would need your inputs for any other questions from dermatology, which was there in the exam, which you can recall, or maybe you can recall the topic. So, anything else? because I believe they would have given a little more weightage to dermatology. This is too less, but probably we have not been able to get all the questions. So I would need your help here to tell me if there were any more questions, or even if you can help me with the topics which were there, so that we at least know that probably this was asked. Okay, so there were not many questions from dermatology. Probably something from the integrated section, something which was integrated with either medicine or anything. But I think psoriasis and arthropathies was a little integrated question. So nail pitting, I think we've discussed. The first question had nail pitting. Was there any other question on nail pitting as well? Thank you, Dr. Yogi. I will make sure, though, when I teach this rose gardener's disease, I do mention that it can be a gardener or a farmer, but I will make sure that I do that next time. Okay. Any other inputs from all of you before we wind up this session? And I believe me, you would have done good. So just relax now. You've given a big exam today. Sleep well, and I'm sure you'll do very well in the when the results would come. So I'm not getting any more input. So I think then this was it in dermatology. And even if you feel that there were any more questions, feel free to put up in our Facebook page or on our app or wherever you feel comfortable, so that we can ultimately upload the final question paper. So thank you so much, and thank you for helping me out with these questions, and all the best for your results.